So occupational health nurse is precisely identifying, recognizing, evaluating and monitoring the health hazards at any workplace. It can range from physical hazards, biological hazards, benzene, noise, asbestos, lead. So what you have to do is that you have to identify that there would be a risk, minimize the exposure, and then have a barrier so that the employee is not exposed to that. And it can be in many ways. You can just remove the exposure or the hazard, or you can go on to give somebody a respirator. That's the nutshell of doing it. So I in past have done clinicals at the bedside. I was involved in training. I was involved in quality improvement in patient safety, policy making, listening to complaints, resolving them, incident reporting, and resolution of incidents. And this kind of gave me an insight and an experience that I knew a lot when it comes to healthcare in many different ways. So this opportunity came my way, and I thought this was something that I can give all to everything that I have had experience of. I can put it into this thing. So I am my own inspiration, because there are not many occupational health professionals in this field, especially nurses. And it kind of everything kind of became a point of interest for me. But it comes from the experience that I had and the place that I was in currently, the health sector that I was in currently. It all mixed up, and this opportunity was something that helped me become an occupational health professional. Making sure that employees are safe is a completely different experience, if you are in the background, because when an employee comes to you and tell you that this is what I'm going through, you actually sit and listen and tell them these are your options, you go through this. If you go to a place and you say, this is what I'm advocating for, this is what I'm doing for my employee, and I want them to be safe, and they have to have this respirator present at this place, you feel that you've added to a barrier that the employee would never get sick at that workplace. You go to a petrol station and you are doing a dermal assessment with the employees. You are making sure that this employee would not get God forbid, a cancer in the longer run, because you're making sure that the exposure is well below the occupational exposure limit. So you are trying to make sure that an employee, a staff, a worker who's earning the livelihood for their family is going back safe, is not exposed to something, is not ending up into a disease or an injury, and is able to safely earn that livelihood for the family that he's working for. So what you'll do basically when you're saying if you're doing it under public health nursing, so you'll do an HR, you'll do a health risk assessment at a site that's being inaugurated, or if it's a site that's already there, you'll go, you see, okay, there are 60 hazards, every hazard has to be evaluated and monitored for how it will affect the employee. If you have a firefighter, if you have somebody who will provide first aid, are they fit to work? That's what you will do for employees that you're working for. Or for example, you're at a place where there is a generator and an employee is being exposed to a noise that more than 85 decibel. You ought to tell them that this is the air concealer that they have to wear. Apart from that, you'll see a lot of times that there are ergonomic related issues. People are standing for longer times. People are exposed to heat for longer times. How do you maintain their own health in those times? Ask them to take breaks for get up from their desk, take break. Go from the heated environment to a place which is colder, take break, drink water, then come back. So this is what I basically do. I go to a site, I see that this is an employee doing this thing, and they need to be supported. They need to be safe from the hazard that they have right now. So nurses have to be nurses. You have to have the basic knowledge of nursing. Becoming an occupational health nurse is not difficult. You need to do some courses, and it's basically on-job training. So you go on-job, you do HRAs, you do fitness to work, you understand mental health practices, how does ergonomics work, and you are a good occupational health practitioner. Because we are currently very far behind in what occupational health entails. Apart from a few bigger corporations, we don't have it anywhere. So it's a very nascent, it's at very nascent stage right now. You have to go to these corporations and advocate for the employees that are working there. You have to liaise with government to have health, safety and environment as the basis of any such corporation, which is probably a corporate or a consumer good corporation, or where employees would be affected by such hazards. So there is a lot to do, but you have to start by liaising, advocating and researching at this point in time.